Hello friends, today let's talk about the definition, objective and scope of rehabilitation. First, let's start with the introduction. According to various estimates, about 5 to 10% of the world population is affected by one or more disabilities. Since over 70% of our population in rural areas, the number of those with less severe disability could be much larger. The incidence of disability is reported to be just over 2% in rural area and 1.6% in urban area. Prevalence was marginally more among males. About 1 in 4 in rural area and 1 in 5 in urban area are reported to be severely disabled. In modern society, acting independently is of supreme. Due to physical or mental handicap, a disabled person cannot act independently in many spheres of life and hence faces many problems in social adjustment. His or her incapability generates emotional problems like apathy, self-pity and resentment and tends to isolate from society. Next, here comes the definition of rehabilitation. Rehabilitation is the utilization of the existing capabilities of the handicapped person by the combined and coordinated use of medical, social, educational and vocational measures to the optimum level of functional ability. It makes the life more meaningful, more productive and therefore worth living. It is the third phase of medical care after prevention and curative. Here next comes the definition of health. According to World Health Organization, health is defined as a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. Here comes the definition of disease. A pathologic process with a characteristic and identifiable set of signs and symptoms. And next comes the level of prevention of a disease. Any healthcare that attempts to halt a person's slide down the slope of the health status scale is termed as preventive healthcare, and any attempt to push it up towards the peak, that is, optimum, is termed as therapeutic healthcare. This total spectrum is classified into 3 levels of prevention by the World Health Organization. First, primary prevention, secondary prevention, tertiary prevention. First, coming to the primary prevention, it explains as measures taken prior to the onset of any disease, for example, immunization against childhood infection or chlorination of drinking water. It is designed to promote general health and to improve the quality of life. Next comes the secondary prevention. It is explained as a measure taken to arrest the development of a disease while it is still in an early asymptomatic stage of the disease. It involves early diagnosis and immediate treatment. Next comes the tertiary treatment. It is explained as a measure taken to minimize the consequence of disease or injury once it has become clinically manifested. Definition of impairment, disability and handicap. The World Health Organization defined this term as follows. First, impairment. Any loss or abnormality of psychological or anatomical structure or function, for example, loss of finger, loss of pinna of the ear. Not all impairment leads to disability. Here comes the disability. Any restriction or lack of ability to perform an activity in the manner or within the range considered normal for a human being resulting from an impairment. For example, difficult in walking after lower limb amputation. Next, handicap. A disadvantage for a given individual in his or her social context resulting from an impairment or a disability that limits or prevents the fulfillment of a role that is normal for that individual. So, impairment is a manifestation of a problem at the tissue or organ level, disability at the level of the individual, while handicap in the translation of a problem at the societal level. Here comes the type of disability. There are two types of disability. One is primary disability and secondary disability. Disability that are direct consequence of a disease or condition are called primary disability. For example, paraplegia following spinal cord injury, inability to work following hip fracture. On the other hand, disabilities that did not exist at the onset of primary disability but developed subsequently are called secondary disabilities. Secondary disabilities are indirectly related to the disease or condition that is responsible for the primary disabilities. Examples are joint contracture in poliomyelitis, subluxation of shoulder joint in hemiplegia. Next comes the diagnosis of disability. Diagnosis of disability may be expressed either in terms of the amount of disability, that is disability evaluation, or in terms of the amount of remaining function, that is functional diagnosis. The total person physically, emotionally, and socially must be considered in the diagnosis. The patient is evaluated as a human but not as a case. The expression of disability evaluation or functional diagnosis varies according to the method used. The most common method is numerical presentation in either percent or digit based on a specific scale. Here comes the different type of handicaps. The World Health Organization has identified 6 handicaps. First, locomotor, which forms 60% of all handicaps. Second one, visual. Third, hearing and speech. 4, cardiopulmonary. 5, intellectually challenged. 6, emotionally disturbed. And here comes the objective of rehabilitation. Rehabilitation must be started at the earliest possible time in order to ensure the best result. It is administered in conjunction with a specific medical or surgical treatment of the precipitating disease. And now here comes the scope of rehabilitation. In a person with disability, it is not possible for a single person to guide the whole course of rehabilitation. Due to diversity symptoms and the presence of disease which leads to disability, optimum result can only be obtained when a group of qualified professionals get together and chart out a comprehensive program for the relevant disability. Rehabilitation may be medical or socio-vocational. Medical rehabilitation is the utilization of medical and paramedical skills to help treat the patient. The role of medical rehabilitation is to limit disability. Socio-vocational rehabilitation are sometimes delivered simultaneously along with medical follows rehabilitation. And here comes the rehabilitation team. The members of these groups are classified according to their areas of specialization and function. First, medical and paramedical team, and second one is socio-vocational. First comes the medical and paramedical team. And first team is Physiotrist, also known as physical medicine. The Physiotrist is the leader of the rehabilitation team. The function of the Physiotrist are clinical assessment of the patient, functional diagnosis, evaluation of disability, coordination with other members of the team and charting out a line of management with their help, rehabilitation surgery to correct deformities, prescription of physiotherapy, occupational therapy program, orthosis and prosthesis, vocational evaluation, counseling, training and job placement, statistic research, review and follow-up of the course of rehabilitation. And the next member is physical therapies. The physical therapist assists the patient in movement restoration. His tasks includes the following. First, muscle strength evaluation and quantification. Second one, exercise to maintain and increase joint range of motion. Third one, evaluate and train sitting and standing balance. Fourth one, exercise to increase strength, endurance and coordination for other specific muscle groups or the entire body. Occupational therapies. The World Health Organization defines occupational therapies as the art and science of directing men's participation in selected activities to restore, reinforce and enhance function or performance or decrease disability and thus to promote healing. The occupational therapist is involved in evaluating and training the patient in self-care activities such as dressing, eating, bathing, and personal hygiene to maximize independence. Prosthetist and orthotist. The prosthetist and orthotist is responsible for the design, fabrication, and fitting of the orthosis, that is brace, and prosthesis, that is artificial limb. Recreation therapies. The recreation therapists use recreational activities to improve social and emotional behavior and promote the growth and development of the patient. And next is the rehabilitation nurse. The rehabilitation nurse maintains the health of the bedridden patient and helps to reach short and long-term goals. She takes care of nursing needs during hospitalization and in the rehabilitation ward. In some cases, she makes house visit and look after the self-care activities of the patient. And the next member is speech pathologist. The speech pathologist helps the patient in the area of communication and swallowing. Psychologist and child development specialist. The psychologist prepares the patient and his or her family member for full participation in rehabilitation. And next member is horticultural therapies. Trees and plants soothe the mind. The cultivation of flower, vegetables and ornamental plants is thought to have therapeutic value in building confidence and self-esteem. Music therapies. Music is one of the finest of the fine art. It transports one to the highest plane of ecstasy. The intervention of the music therapy may involve instrumental or vocal performance by the person with disability or helping him appreciate music or attend musical events. Dance therapies or play therapies. Dance therapy and play therapy is practiced more often with mental health patients with physically disabled patients. The dance therapy is sometimes called as movement therapies, rhythmic body movement as physical and psychological medium to improve gross motor control and to relieve stress. Biomedical engineer. The field of rehabilitation is an interface between the medical and engineering professions. With the advancement of technology, we have newer user-friendly environment, control units, communication aids, orthosis and limbs. All these have to be designed by electronic and mechanical engineering professionals. And here comes the socio-vocational rehabilitation. Socio-vocational rehabilitation is a team effort which aims at providing the disabled a vocation and reducing handicaps. It is a concept of the right to work, that is to treat work much more than a means of money, but a way of living and mode of dignity of the individuals. Socio-vocational team. The first member is social worker. The social worker has a very important role in socio-vocational rehabilitation. This is because he has to interact with the patient, family, and rehabilitation team. The first one, evaluating the patient's living situation, including lifestyle, family, finance, and community resources. Second one, to analyze the patient's social situation in relation to his present situation. Third one, to explain to the family the patient's problem and the treatment recommended by other rehabilitation team and suggest alternate living condition. Fourth one, help the patient and the family to work out a way for a more adequate social adjustment using social case work technique. Group activities with patient family members for imparting knowledge about the illness and care of the patient. Vocational counselor. The vocational counselor is an important professional in the socio-vocational team who identify the right vocation, skill or way of life of this patient. The skilled trainers train the client in a particular vocation and placement officer place him a suitable job. And third team is special educator. Disability is viewed as a punishment and act of God by some who will refuse to cooperate by the patient. The special educator shows a path of appropriate behavior, and if reinforced by family and team of the patient, then improvement is expected. And the next theme is NGOs. It is not only the responsibility of the government to take care of the disabled, the community is also responsible. Several philanthropists come together to set up organizations catering to the rehabilitative requirement of the handicapped. Some of these areas run by handicapped individuals themselves. And the next theme is banks and the funding agencies. Helps by giving money to deserving candidates to set up dealership and business at concessional waiving with certain clauses and requirements. And next member is placement officer. He places the disabled individuals in suitable jobs and visits at the workplace frequently. He coordinates with the social worker, the counselor, the candidates and the employers regularly. Next topic, delivery of rehabilitation. The delivery of rehabilitation is done through the following approach. First, institute-based rehabilitation, which calls IBR. Second one, homes. Third one, daycare center. Fourth, outpatient clinic. Fifth, camps. And sixth one, community-based rehabilitation, which is also termed as CVR. Here comes the conclusion. It is the collective responsibility of the able-bodied to rehabilitate the handicapped individuals. The role of rehabilitation is to minimize disability and handicap and help the handicapped person lead a useful life within the limitation. In other words, make a disabled person into a differently abled person. And goal of rehabilitation is not to produce an immortal being, but to maintain an optimum health as long as possible, ideally until death. So, add life to years, not years to life. Thank you.